Hey, you're coming in for a consult for a brachioplasty. We're super excited about that. Brachioplasties are something we do a lot at New Life Cosmetic Surgery. Brachioplasty, or aka arm lift, is when I remove loose, saggy skin underneath the arm. My preference is that you get to that ideal weight before I do that. And the reason being is if you have a lot of fatty tissue there, and I need to first liposuction that fatty tissue out and then tighten the skin. Whenever you do liposuction in an area, it causes inflammation. And so if I have to do a lot of liposuction in and around your arms and then try to tighten it all in the same surgery, it can cause a lot of tension on the incisions, and the incisions just don't heal well. So we have two options. If your arms are larger and you have loose, saggy skin, you might just want to start with just liposuction. Remove all that fatty tissue. Wait for about 3 months. You're going to have some loose skin. Then go back at the 3-month mark and then tighten up all that loose skin. If you just have a small amount of fatty tissue and a lot of loose skin, we can do the liposuction at the same time as removing the skin because we won't have as much inflammation, but it's something that we'll discuss in our consultation. But if you come in and you are at the right weight and you just have a lot of loose, saggy skin, we can nail it just with one surgery, with a brachioplasty surgery. Things that you need to know about with a brachioplasty surgery is, obviously like time off and activity afterwards. In general, you're gonna wanna take about a week off of work. Your arms are super tight in that first week. And so you wanna just take about a week off of work. You're gonna, in the first 2 weeks, need to have everything at shoulder height or below. So you need to make sure that everything in the house is at the appropriate level so that you're not having to raise your arms up super high. Because in the first week, 2 weeks, you're gonna have your arms at this level. And then at 3 weeks, more and more and more. And by the 6-week mark, you're gonna be able to raise it way above your head. But in those first 2 weeks, you need to be making sure that you have those things in place. Protein is also super important. We're gonna stress protein. 100 grams of protein a day is really gonna help with those incisions and the healing of those incisions. As far as the scars, everyone's always concerned about the scars. We're gonna do everything we can to give you a nice, smallest linear scar or straight scar going across your arm as possible, but there's things that like your genetics and just how you form scars in of yourself, and we'll do everything we can, but some of these things are outside of our control, but we've done hundreds of these brachioplasties. We know what works, we know what gives you the best looking scars as possible, and I promise that I will do everything I can to make sure that your scar heals as pretty as possible. Other things that you might be concerned about is infections or things like that. Really, infections are rare in brachioplasties. We do give you antibiotics to help prevent those infections. But it's really a safe surgery, and we're super excited that you're interested in it, and we would love to talk to you more about it in the office. I guess the last thing I want to talk about is people ask about anesthesia. How do you do your anesthesia? We do it all under total intravenous anesthesia. So we give you an IV in your arm. We put you to sleep, and you're able to remain asleep throughout the entire surgery. After the surgery's done, we stop the anesthesia and then you wake up. But you do not need to be intubated or go under general for the surgery. So it's super cool. We can do it in a type of anesthesia that's safe and effective and has limited risks for you.